Is there objection?
Madam President.
Senator from Washington.
Madam President, reserving the right to object. We have a serious public health crisis on our hands right now, and we expect it to get much worse. Right now, families across this country are actually looking to Congress to put partisanship aside and put their needs first, and counting on us to listen to experts and make decisions that are guided by science, not by ideology. They need to know that our #1 priority and what we should be talking about is public health today. So instead of discussing this harmful bill that will gut reproductive rights and put unnecessary restrictions on medical providers and undermine medical research, which is an absolute non-starter and the absolute last thing we should be doing right now, I think we should be focused on what families actually need us to be focused on, which is the coronavirus outbreak and what it means for them and what we are doing about it. The news of this virus is spreading throughout the country, and the deaths and the illness and the confusion it has caused in my home state of Washington and elsewhere is beyond alarming. The Trump administration has fallen far short of its responsibilities to Washington state and to communities nationwide. Now, I am pleased Democrats and Republicans in Congress were able to put partisanship aside to hammer out the robust emergency supplemental funding agreement that was announced earlier today. It's an agreement that goes well beyond President Trump's totally inadequate request in order to actually meet the needs we're hearing about from the officials on the front lines of this crisis, like reimbursing states and local governments who have shouldered the cost of this response so far, or the need to support research so we can develop new treatments and diagnostic tests and vaccines, and the need to make sure that those are available to everyone. This agreement helps us prepare for what's next by providing funding to shore up our store of medical supplies and support community health centers in underserved areas and bolster global health and public health preparedness programs. So I'm working to make sure we get that bill signed into law as soon as possible, and I will continue to follow it closely because experts have already made it very clear this is not going to be over soon. And while the funding is a great step, we need to make sure it's not the last one. It is very critical that we continue listening to our health experts, providing needed resources, and preparing for what's next, including what this will mean for families' day-to-day lives and for people who can't take a day off work without losing a paycheck, or don't have affordable childcare if their school closes, or don't have a health insurance, or who are experiencing homelessness. So I hope my Republican colleagues will think long and hard about what their priorities are in the midst of this and choose to refocus their energy on working with us to address the urgent issues of the day. So instead of distracting us from serious work and wasting time we don't have. So I object, Madam President.